Okay, so we're gonna go over some mid-back thoracic spine mobility. So this junction right over here. So this is an area that tends to carry a lot of tension, whether you're super active, sit at a desk, not as active, it's gonna be an area that tends to get tight. And that's because we have 12 ribs that come into the area. So it's an area that's got a lot going on to begin with. All our big internal organs are here. So it's kind of an area we have to do a little more maintenance on a daily basis to get it moving. It is kind of the reality. There's no real magic cure cheat sheet to it, but movement is kind of our best friend. So my favorite kind of go-to hack that feels pretty good, I find, unless you are in like an acute pain situation, then it might be a little too much. But for a day-to-day like maintenance basis, a lot of my patients that are consistent with this, you can really feel the difference in through their back. It's honestly something I rely on a daily basis too. So we're gonna have it, I like a smooth foam roller because the bumpy ones just feel terrible. So we're gonna have it here. You're gonna start between like tops, that last rib up through here to kind of as high up as you can comfortably get in that mid back. Roll it up through here. I like having the hands under the head so you're nice and supported, and that way your head's not just floating and tightening up. You're giving yourself a little break, and then you're gonna arch your back as much as you can, and then rounding up. Arching as far back as you can. You might hear some cracks, and that's totally fine. That's just gas release within your joint. Arching through the back and coming back. So it feels kind of like little crunches, and it could be a little awkward the first few times you do it. You might feel like you're almost falling off because it's hard to control. But the better you get with this, honestly, it becomes like a really nice end of day relief position, especially if you've been bent forward in front of the computer, or if you're a new mom taking care of your baby, or just in general. It's a really good like way to open up the body when you've been doing a lot of activity. So this one, I like to spend 8 to 10 repetitions moving up and down the spine. And to be honest, I don't really count it out anymore. I just kind of do what feels good. So I would recommend just doing a few rounds until you feel nice and loose, rocking back. What I don't recommend is actually rolling out your lower back, because one, we already have a natural arch in our spine, and by doing that, we're kind of just shoving ourselves a little further. So it doesn't actually give you that stretch relief you're looking for. It sometimes can stiffen. It might feel good in the moment, but afterwards, you just might feel a little stiffer. So stick with like that last rib and above area just to get a little movement. So give that thoracic spine a break today and try out the stretch.